Here was a state that could once flaunt its COVID efforts. It's now struggling to cope with a massive uptick in daily COVID cases. Kerala accounts for 50% of the cases in the country, and that's a huge cause of concern. Today, Kerala became the first state to report over 22,000 COVID cases in the last 50 days. And what we've been seeing is really through the month, Kerala reporting over 10,000 cases every single day, with a 7-day average of nearly 17,000 cases. Kerala's positivity rate now has climbed up to over 11%. This relentless spike in cases comes even as people continue to go about life as usual. Some even seen flouting norms in Kottayam. Kerala's Kottayam has seen a 64% surge in COVID cases in the last 4 weeks. Appalled at the rise in cases in Kerala, the central government has intervened and questioned Kerala authorities. The government has been pulled up over relaxations of curbs during Bakrid that can be linked to the spike in cases that we're seeing currently in the state. Kerala is a state that's considered to have the best healthcare system in the country, as well as a very efficient system in place. Kerala now is failing to live up to its expectations. Here's a report by Sneha Mordani on why cases are surging in Kerala.
The state, once touted for controlling COVID effectively, keeping deaths at a low and sending healthy people back home, is now in the news for all the wrong reasons. Kerala now accounts for 50% of COVID-19 cases in India.
अगर आप देखें कि देश में आज भी चाहे केसेस कंसंट्रेटेड मैनर में पाए जा रहे हैं, लेकिन अभी भी देश में 22 ऐसे जिले हैं जहां पर कि पिछले 4 हफ्तों में हमने एक इंक्रीजिंग ट्रेंड इन केसेस नोट किया है। हमने आपको दर्शाया है स्टेट वाइज ऐसे कौन से जिले हैं जहां पर कि वीक ऑन वीक बेसिस पर अगर हम देखें तो पिछले 4 हफ्तों में केसेस में संख्या में वृद्धि हुई है। यह वृद्धि एक मान लीजिए कि लिमिटेड नंबर ऑफ केसेस से थोड़ी भी वृद्धि है तो यह कॉज ऑफ कंसर्न है, जिसके लिए हम स्टेट से डिस्कस करते रहते हैं।
A drastic increase of cases has been seen in the last 4 weeks. Documents accessed by India Today show Kottayam has seen almost 64% increase in cases in a month. Malappuram has seen a 59% jump in cases. Thrissur recorded a 45.4% rise during the same period, and Ernakulam has seen a 46.5% increase.
India Today has accessed this letter that has been written by Union Health Secretary Rajesh Bhushan to the Kerala government, talking about the fact that the central team that visited Kerala in the first week of July has made some observations about what really is going wrong in the state. Containment has to be improved in the state of Kerala. This letter also talks about the fact that certain super spreader events have been witnessed in the state of Kerala, which has clearly led to the spike.
In his letter, the Union Health Secretary says Kerala needs to do more in terms of containment. Home isolation cases, currently accounting for 95% of the active cases in the state, need to be done as per the guidelines of the Union Health Ministry. Bhushan also points out that between July 10 and 19, Kerala has seen a spike of 91,617 cases and 775 deaths. The centre says ramping up vaccination and reducing wastage is needed. Higher test positivity of 10.5% may require more stringent measures and restrictions. The centre says another problem in Kerala is non-adherence to COVID-appropriate behaviour among migrant workers. It says some positive patients have refused to get admitted to isolation centres and they need counselling. The centre has already sent a team to Kerala to review the situation in the first week of July. A team is being sent again. With Sneha Mordani, Bureau Report, India Today.
On the other side of a short break here.